I'm Peter Merchandani, a full professor in SKY. SKY stands for uh, School of Computing and Augmented Intelligence. And my area of expertise is actually a whole bunch of things in SKY, which includes optimization, machine learning, artificial intelligence, and so on. And the project that I'm working for in CAOE is, by the way, in CAOE, I'm also the chief scientist. The project is on proactive response in disasters. And we started out working on the disasters, were hurricane disasters. And now we're working on pandemic disasters with COVID issues. In the COVID issues, we started looking at how do you simulate pandemics, and that made us develop new epidemiological models. And I had a great partner and collaborator, I should say, David Morton, and he also had been working on epidemics before the project started. So he brought that machinery into the project, and we started working on epidemics, and we got some really interesting results there. And then recently, for the last 1.5 years, we have noticed that because of the pandemic, people have stopped working as well or as efficiently, and there's absence and so on. So it started off what was happening in China, and because what was happening in China, the supply chains came to US. It happened in US, some other things that were coming in by ship. Also within US, there were issues to do with food production, because people who were producing food it's a labor intensive, so people did not work in the food industry as much. So our food production went down, and our cost of food, one of the reasons we got such high inflation in food is because we do not manufacture as much food anymore. And so we decided that we should really think about, we are really interested in this whole subject of disaster response, that we should also look at the supply chain part of it. And that's a new area that I'm trying to develop.
Right, so we were working on hurricanes in terms of disaster response. And we were looking at the diesel fuel supply chain in that context. And then when COVID-19 hit, so I'm at Northwestern now, but I used to be at University of Texas at Austin. And so after H1N1, I have a collaborator there, and we worked together on pandemic preparedness, including things like antivirals, vaccines, and ventilators. And so that was, 2009 was H1N1. So that had been a little while, but we developed a nice collaboration then. And so then when COVID-19, we talked about sort of restarting that collaboration. And then we talked to the center and the folks at DHS, and they were good with us kind of doing that pivot. So the whole goal of our staged alert system is avoiding overwhelming a community's hospitals. But we want to do that while limiting socioeconomic harms. So these are really key to simultaneously securing the nation's critical infrastructure in terms of healthcare and public health, while ensuring the country's economic prosperity by minimizing these socioeconomic harms.
What we've been doing is developing models to understand how the food supply chain was impacted by COVID-19. And so we're developing models that can capture the extent of the disruption so that we can explore how different strategies can be used to minimize the disruption. The, unique aspect of the simulation model is that underneath the food supply chain process is this epidemic model that incorporates the health status of the workers. So we're modeling the potential spread of COVID-19 that workers can get both at home or in the workplace, and then how that impacts overall their productivity at the plant level because they're not able to come in. And so some of the mitigation strategies that we're looking at through the simulation model is like the various social distancing policies that were put in place, which have a direct impact on the number of people that are there and consequently the number of products that are going to be available, like through the supply chain. The pieces fitting together. So there's a common piece to what we're all doing in the sense of using these epidemic models, or these models that describe how people can contract COVID and eventually recover. But we're looking at how that impacts different levels of, or different types of infrastructure, right? So from Dave's perspective, he was looking at it with respect to, vaccine distribution and hospital capacity scheduling, and coming up with that alert system to let the state know, what the impact that would be in terms of the different policies they were implementing. And then from like myself and P2, we were trying to look at it with respect to other aspects of the delivery of essential goods, right, or services. And so that could be from a public health perspective and vaccine distribution, as well as food distribution. So like I said, I think it's the Common Core is just trying to understand how to take these individual epidemic models and build them or incorporate them into something that explains what's happening at like a state level or multi-state level with respect to provision of services for the population.
They did everything from, implementing a mathematical computer model of disease dynamics and how a disease is transmitted among the population. So implementing that core computer model to calibrating that model.
The goal of it is to develop algorithms, procedure, as well as visualization of a real-time decision system. The goal of this project is to assist the emergency responders, such as federal, state, as well as local, to be proactively respond to disaster and emergency, which are usually cascading in a highly uncertain manner. And in terms of my role, the first task that I have to do was to develop a simulation model. The goal of the simulation model is to generate the probabilistic scenario trees to depict the storm uncertainty. Experience strengthened my the mathematical modeling skills, as well as my analytical skills. The other thing that I learned is about storms, as well as their impacts towards critical infrastructure.
So I was both modeling the disease dynamics and also recalibrating the model throughout the pandemic, because even though we had a very detailed model, things keep changing throughout the pandemic a lot. Trying to find what are the different changes in the disease and how can I incorporate those different changes into our model. So now I'm doing retrospective analysis to these different systems to see which system worked well, what are the key indicators that were signaling that something is happening, maybe the case counts is increasing, or maybe hospitalization is increasing, and so on. So my current effort is to learn as much as possible from the experience we have and use the data, bunch of data we have from the COVID-19 pandemic. So use that to be prepared better for the possible future pandemics.
I was developing the algorithm, the modeling, and collaborating with another student, Daniel Duque, to carry out the computational analysis. So this one was a very interesting project, and it actually trained it trained my skills in analyzing the data, performing data cleaning, do the data modeling, fitting the models, and so on. So it is like, it very much fitted into my disruption research, which was my thesis topic.
Yeah, so I was towards the end of my PhD, and so my PhD is in operations research, and the questions that came in that vein were, how do we use optimization and operations research to help build decision support systems for COVID-related stuff? So in particular, we were interested in building an alert system that could inform, for example, a city when to exercise a lockdown so that COVID surges wouldn't get too bad. And so the case study that we used and that we worked for a couple of months was with the city of Austin, in which we implemented a tool that essentially allowed them to monitor what was the rate of intakes in hospitals related to COVID, and at what stage do they need to exercise different levels of lockdowns.
My specialty from the industrial engineer, where I'm focusing on, is basically on supply chain for the most part. And one thing that this project is bringing to their attention is food insecurity. So pandemics like that can cause food insecurity because clearly, since we are working on the food processing industry or the food supply chain at large, when pandemics occur and then we are not able to address these things, productivity reduces, and then all sorts of food insecurities occur. So for my current work, we are looking at ensuring equity in food banks in the counties in North Carolina. So that's for my work, I really focus on how to visualize to help stakeholders to make decisions. So food insecurity at large is where my research area is, and what we are currently working on, how we are going to address such issues.
This type of project or this type of practice helps us or helps the decision makers to come up with drill processes. So you can actually use our model, you can use the data analysis procedure to help you to prepare for later disasters. What type of data can be used for operations researchers, and how often do we need to update the decision maker, to update the policy maker? So all those things, it could come up with a plan, like a tabletop simulation for this future disaster relief effort. So I would say like that's probably the more potential impact for future.
Some interest about the work that we had done in terms of evacuation. Therefore, Dr. Marchandani suggested let's write a book, because this book will allow people to know. It's sort of giving insights to people. We don't want to be too much detail, but we also don't want to be too general. So it can trigger people's interest on how to develop emergency response that consider uncertainty.
I don't know if all the tools we'll develop will actually get used in practice, but I think just the experience for myself and the students to work on something that is practical, like a real world application, is very rewarding.
And that Homeland Security, if they use some of these ideas in their organization, because they've got so many areas they are in. They're starting to think about food production and food prevention, food security. They're starting to think about supply chain resilience and disasters like hurricanes. We also have health issues. And the health issues in hurricanes are that people get sick, don't get enough medicine and all that. So all these things are related. We hope that some of our results are used by the Homeland Security enterprises. I mean, it's Homeland Security Department as well as other places.